Many eye diseases and conditions can be prevented if we maintain a healthy lifestyle that includes diet, exercise, and wearing sunglasses. Dr. Mark Slosar tells us how dietary supplements can be an added boost to preventing certain eye conditions.
I think one of the most exciting changes that's going on in optometry right now is the fact that we're realizing that our general health absolutely affects our eye health. And because of that, we've really realized that we need to be proactive in trying to work in preventing eye disease rather than just treating eye disease. You know, we really launched into carrying nutritional supplements because of a condition called age-related macular degeneration. This condition affects 15 million Americans that are heading towards blindness and millions going blind each year. So we really launched out in realizing that the studies were clear that a nutritional supplementation could help slow down or stop the progression of macular degeneration in certain patients. In doing our research, we really brought in a line of nutritional supplements that were head and shoulders above other supplements on the market. We actually recommend very strongly that patients with a family history of macular degeneration or macular degeneration themselves take a good quality antioxidant. In addition to antioxidant, I believe they should be on a good quality men's or women's multiple vitamin. And in many cases, they should be on an omega product that's of a pharmaceutical quality, that's a higher quality than what you can buy at a drugstore or at a supermarket. You know, it's not uncommon for us in this society to be spending hours on a computer. And with those hours of spending on the computer, our eyes go through a great deal of fatigue. Just think about combining that fatigue with the fatigue of not sleeping well, since 1 out of 3 Americans don't sleep well at night. And that absolutely can play havoc on our general health and on our eyes. One of the products that we have in the office is called Sleep. As its name implies, it absolutely helps deepen our level of sleep, double the REM sleep, which is the more restful sleep, so that when we wake in the morning, we wake with a more rested feeling about ourselves. It's not uncommon for us to recommend Omega Max, which is a product by Amerisciences. It's a product that not only helps in terms of macular degeneration, but it also helps in terms of dry eye. Dry eye is a very significant problem in eye care, especially when it comes to the amount of hours we put into close work or computer work. Why would an optometrist be recommending weight products to a patient? Well, for me, when I see a patient in the examination chair, and I know that 2/3 of the American public are overweight, 1/3 are clinically obese, I think in terms of 10 years down the line, that patient's likely to lead into diabetes. Diabetic retinopathy is a serious condition that leads to blindness. The AMA now recommends that every adult American take a multiple vitamin. That was unheard of years ago because we always thought the food pyramid chain was all that we needed. But foods alone do not cut it anymore.